Hi everyone, thanks for watching. In today's video, I want to talk about kind of a touchy topic. So a lot of members in the total knee replacement support group will post comments about their surgeon requiring the member lose weight before qualifying for the total knee replacement procedure. Now, weight loss is an exceptionally frustrating topic. I'm the first one to say if somebody had the solution to weight loss, there would be no overweight individuals, right? We all know what to do. And for many of us, especially those of us in healthcare like myself, I can tell you that 20 years ago, when I graduated college, I knew the answer. It was really simple. It all came down to math. I would explain to my clients almost every single day. It's 3,500 calories makes a pound of fat. So if somebody moves an extra 250 calories a day and eats 250 calories a day less, they create a 500 calorie deficit. 7 days, that's a pound of fat. You are on your way to a successful weight loss program that's sustainable. Problem is, it just didn't work. Now, for some people, that works amazingly well. And I'm not taking anything away from you. If you have a weight loss strategy that's working for you, I'm super happy for you, really, because it's the most challenging thing we face in healthcare. But what I will say is for those of you who are frustrated, for those of you who continue to eat less, continue to exercise more, continue to deal with persistent knee pain, hip pain, back pain, all of these compounding factors that make weight loss seem impossible, I'm not here to tell you how to lose weight. I wish I could. But what I'm here to do today is to expose you to some new ideas. You know, the terminology of hormonal weight gain showed up a while back. There were some amazing researchers that came out and said, look, in the world of weight loss, it's much more complex than calories in, calories out. It's much more complex than move more and eat less. That works for a fraction of the population. And even then, to maintain the weight loss over long periods of time, it's exceptionally hard. So I want to share with you a little peek into, what I teach my clinical students. So I'm a physical therapist. I get students from all around the country that come do clinical rotations with me. And, as a student, because I was in their shoes, you don't realize when you're 20 and, weigh 100 pounds and you're active and you're doing all this stuff and you can eat whatever you want and not sleep, and you don't realize how challenging and what other factors come into play. So today specifically, I'm going to talk about a condition known as Cushing's Syndrome. Now, I'm not going to say that anybody here watching this has Cushing's Syndrome. Certainly, I'm not an endocrinologist. I don't have the depth of knowledge that a physician would have who specializes in these kinds of conditions. My goal for today is really just to show you a couple underlying, possible causes for the frustration patients have losing weight when they're in persistent pain, when they have a knee, a hip, a low back that just will not give them any relief. So let's take a look at this. I'm going to share my screen here real quick, and I'll show you guys a couple resources. So this, a little discussion about what Cushing syndrome is. And the only reason why I picked this is because this is what I typically see coming into my clinic. And it's just such a common situation. So certainly, Cushing syndrome, it's a disorder with physical and mental changes that result from having too much cortisol, stress hormones. The cortisol is important. It's a normal function of life, but like anything, too much of anything gets in the way. So there's usually two common causes of Cushing syndrome: exogenous, right? Factors from outside the body, and endogenous. And I think this is where there's a lot of confusion. So when we're looking at the most common causes for exogenous, coming from outside the body, it's medication. It's steroidal medication. And that's, many of my clients come in, they've been on a round of prednisone, they've tried steroids. The most common report I get is, while for many, it helps reduce the pain and the symptoms, for many, it also just packs on the pounds. They swell up, they gain all this weight. It doesn't make sense relative to the amount of food that they eat. But I can see a person go on a round of cortisone and they could gain 10, 15, 20 pounds in just a ridiculous amount of time, that there's no way they could possibly eat enough food to justify calories in, calories out in that situation. But this is why. It's because the medication is altering the hormonal profile. Now, endogenous, coming from within the body, this is typically attributed to somebody who has a tumor on the adrenal gland or the pituitary gland, something that's going on, and it is extremely rare. Like I said, I do not want you to take this as medical advice. This is just information. This is you and I having a conversation. That's all it is. But I'm going to talk about another version of endogenous causes of something similar to Cushing syndrome. We'll talk about that in a minute. And then you can go through, what are the side effects? You can see that increased blood sugar. So many of my patients are dealing with high levels of blood sugar. They're trying to manage it with medication, certainly, but why? Why do we have this elevated blood sugar? Why do we have this hypertension? Why do we have a thinning of the bones, osteopenia, osteoporosis? These other factors, right? Muscle loss, weakness, thin, fragile skin, bruising easily, purple, red marks. Usually these would be considered stretch marks around the abdomen, depression, difficulty thinking clearly. It's not mentioned here, but difficulty sleeping, there's many, many factors that go into play here. Okay, so why is this important? Why do I want to talk to you, the total knee replacement support group, specifically about this? Because you're dealing with persistent pain. You're dealing with, unrelenting, probably many weeks into months, sometimes years. Many of my patients who have had a knee replacement or are planning to have one are also dealing with persistent low back pain and other complications. Shoulder pain is a common one. And so many of you are taking medication to try and manage the inflammation. Certainly that's going to have an influence on how the body and the hormonal profile is working. It's like somebody who is type 2 diabetic who has to take medication to manage their blood sugar. It is significantly more difficult for them to lose weight, specifically fat tissue, because they're trying to manage their blood sugars at the same time. And the hormones are just wreaking havoc on their ability to burn fat, turn fat into fuel. Another little article, and I'll share these 3 websites in the post of this video in the description. But this talks about glucocorticoids. Now, these are both medications that you can consume, which many of you are familiar with, but they're also natural hormones produced by the body when the body is under stress, when the body is dealing with persistent pain, when you're not sleeping well, when you're not eating well, when you're dealing with a lot of stuff. Your body will produce naturally these glucocorticoids, right? So you can take them, prednisone, dexamethasone, hydrocortisone, or your body will produce them. And so what does Cushing syndrome look like? What's the physical effect, the manifestation of Cushing syndrome? And this is one of those things that I usually will take my students and I'll say, look at some of these photos. Hopefully no inappropriate photos show up here. But I explain, I'm like, this is my classic client who's walking in the door. There's certain conditions that you see. Now, nobody's going to fit this perfectly, but if you guys can see on my screen, you see that little fold at the back of the neck. You see this excess of fatty tissue on the upper back. That's kind of a classic symptom. Now, what isn't as common is they typically have skinny arms and skinny legs. So many of my clients are storing fat tissue kind of over all their body. But the stretch marks around the skin, the rosy cheeks, what we call the moon face, so the rounder face, these are all consistent signs and symptoms of not so much somebody who's over consuming too many calories. This is the picture of somebody who's dealing with hormonal issues that are probably in response to persistent pain problems. And so what's challenging for me, and what I try to talk to my clients about, is, the most standard information out there is eat less and move more. And you more than anyone know, how are you supposed to move when your knees are just in pain? How are you supposed to move when you also have back and hip problems? What is the solution here? And so I just hate to see my patients beating themselves up thinking, well, I just need to eat less. I just need to be more determined. I need to be, have stronger willpower. It's really none of that. It really isn't. It's getting the hormones working properly. Now, even for that, I told you guys I don't have a solution for weight loss. I don't have a solution to fix your hormonal problems either. I just don't. But what I would encourage you to do is get out there and research and try things. Look for clinical research. Look for research that you can support. Like, I'm not selling you guys anything. I have no vested interest, so I'm just sharing this information because I think it's important. So when I encourage people to go look at different strategies to manage weight and manage hormonal profiles, I tell them, look at the university websites. You're on Google right now. There are tons of great TED Talks and webinars and information coming out of university medical centers that are at least somewhat reliable. And if you try something and it doesn't work, if you don't lose the weight, if you don't feel good, if it's not sustainable, just cross it off your list and go to the next thing. Because your body is changing every single day. My body's changing every single day. I'm 45 right now. 5 years ago, what I did nutritionally does not work for me today. And what I did 5 years ago wouldn't have worked for me 10 years ago. Your bodies are changing. Your lifestyle is changing. We're dealing with the stress of the virus. We're dealing with, high rates of unemployment, financial issues. All of those factors are going to come into play. So I would encourage you, think outside the box. Don't just think in the kitchen. Yes, a whole food diet, whatever that means to you, is going to be beneficial. And I would say that there is no secret recipe to making this work. One day at a time. You make micro changes, little teeny tiny changes. You change 1% a day toward something that might work. And before you realize it, you'll see big changes. Guys, I don't know if this helped you or not, but I just felt compelled to say, look, it's more to it than calories in, calories out. It's more to it than going on a vegetarian or a vegan diet or a paleo diet or a carnivore diet or Atkins diet, Weight Watchers, Jenny Craig, like all of this stuff. I can tell you I've seen people succeed at weight loss across all of the different kinds of diets. And I've seen people fail at weight loss across all of the different kinds of diets. So the best advice that I could give, if you were coming to me directly and asking me what to do, I would say focus on getting healthy, whatever that is. Focus on getting healthy, focus on better sleep, and focus on lifestyle. Life needs to be enjoyable. Life needs to be manageable. Reducing life stressors, increasing life satisfaction. That would be my three-pronged approach. And it's not that you're trying to lose weight. You're trying to live a better life. And as a result, your weight will drop. Okay, guys, I hope that didn't waste your time. I appreciate you as always. Please take a minute and subscribe to the channel if you haven't. Like this video if you haven't. And if you think there's somebody out there that's struggling because they're trying to eat less and move more and it's not working for you, and you think maybe a video like this is helpful for them, please share it with them. I always appreciate your time. I always appreciate your attention. Guys, I'll catch you on the next video.